Hey everybody, my name is Gary Sather. I am one of your fellow TGCT patient peers. This is actually a follow-up video to my TGCT villain origin story I posted a couple months ago. So if you didn't watch that one, I encourage you, and I'll link it in the post, to stop here, go watch that one first, and that'll give you a lot of my backstory, and then revisit this video. But to pick up where we left off, my surgeon and my oncologist were kind of back and forth debating on whether or not the best course of action for me would be essentially amputation versus, I guess, indefinite chemo or Turalio with some vacations as needed. Where we're at now, I'm about 7.5 months on the Turalio, a little longer than I said I'd originally give it. It's had its ups and downs. We did dial in all the side effects with a nice little cocktail, I guess, that works for me. My liver levels have actually gotten a lot higher than they were most of my treatment. In the last couple months, they've spiked quite a bit, but they do keep assuring me that even though they are high, and actually some of my levels were even too low, but that they were within treatment parameters, I guess you could say. So they accept it. You know, if I was just a normal person, obviously there'd be some alarms going off, but because of the chemo, that it's okay for now. Part of the REMS program for Turalio, they were supposed to start monitoring me every 6 months now, but because they are high and acting up as of recently, I've had to go back to once a month, which is still better than starting out and you have to do it once a week. But I guess where we're at is they seem to have come to the consensus that they don't see in imaging a reason to amputate anymore. They both feel, and I believe the way they put it is that a bum leg is better than no leg. So they are gearing more towards the idea of basically indefinite chemo with vacations as needed. I haven't gotten a vacation yet because I've had such a response to the Turalio. The tumor shrunk quite a bit, which is good news. I don't know personally if it's still a fair trade to save a foot, versus the damage I might potentially be causing to my liver. They assure me the liver is one of the most resilient organs in the body and can and will recover, so I'm holding them to it. I hope that's true. But I haven't gotten that vacation yet because I have had quite a response. It feels like, even though they haven't said it directly, that they're kind of maybe hoping to get that full response or to see if they can achieve that before taking my first break from Turalio, which is both exciting and terrifying at the same time to have something that works and then to come off of it. But then at the same time, I'd like the break. But yeah, you can see the beard's gone. That's another story. I'll grow it back, I swear. All I can really say at this point is that's where I'm at. That's my journey, and hopefully we are veering away, from amputation, and hopefully they're right. And it's hard to accept the limitations and challenges that my bum ankle is giving me, but ultimately, I hope it is the right course of action, and I hope that it will bring something better. I can't stress enough that on this journey, this time around, how important the TGCT groups, the PVNS groups have been, the forums. They are an amazing wealth of resources and networking, and there's not enough good to say about using them. And when I say them, there's multiple. I can't stress enough to use them all. To put all your eggs in one basket has never really been my style. I prefer to be a part of all the groups because not everybody's a part of all the groups. And to miss one and maybe miss a connection or miss a piece of important information or something that I could relate to or that somebody else can benefit or relate to, is so important. You know, some of these groups focus more on the peer-to-peer connections, which in themselves are very important, and other ones have those connections, but also have a wealth of abundant um, treatment information from doctors, nurses, researchers that are just rock stars and very pertinent and valid when it comes to our disease, and a wealth of information to have at your fingertips. And to both be able to get it and share it and receive it is so important, at least for me, to find those connections. And especially when having this type of a rare disease that we have, um, getting information and the networking is so hard to find in the first place. So I can't explain how grateful I am to have found it and to have those options. And if there's any advice I could give to anybody with this disease, aside from being patient and accepting some of the things that you cannot change, man, it's use the groups, use the forums, use them all, join them, and you can get and you can give at the same time. Sometimes people don't even realize they show up and they're there to look for help and look for a connection and find something to benefit themselves, and they don't realize until later that at the same time, just putting their own story out there allows them to connect with other people, and other people end up getting a benefit from that as well, and it's just a two-way street. So this is my updated story. In a nutshell, I'm waiting for my vacation. And in the meantime, just still trying to do the day to day. And, you know, you guys, if you have any questions, you feel free to reach out and ask. It's always great to network and talk with people who understand what you're going through. And I am one of those people that truly do understand. I am a right ankle TGCT diffuse type patient. But that doesn't mean that, you know, I can't maybe connect on a personal level with somebody who's, you know, maybe experiencing it in a knee or a hip or wherever it might be affecting you. Stay strong, and thank you for watching.